Good morning, everyone. Bob Ravenscroft here for the April 15th press briefing. Couple of things just to go over at the start. With us today is Dr. Daniel Smith. He's an infectious disease physician, studied at the University of Nebraska College of Medicine, and then did his residency with the University of Texas Health Sciences in internal medicine and pediatrics in Houston, and then stayed on for an infectious disease fellowship also in Houston. He's going to be up here in a few minutes to talk about variants. We've had some questions regarding the variants since Dr. Nora's last presentation on that, and certainly it's being talked about readily, so he'll give you the behind the scenes on all of that stuff. For the daily stats, holding relatively steady. Right now we have 16 patients in-house that are considered COVID patients. There are 8 more that are internal that are suspected, but we're pending the test results on, so 16 to 24. As you can see, not many are in the ICU. 3 of them, 2 of them are still ventilated, and most of them are from Lancaster County. Before I bring up Dr. Smith, I know there's a lot of questions about the Johnson & Johnson, so I just want to get some things out there. Bryan, so we don't really need to ask if we've done any of them. We have not administered any Johnson & Johnson shots here. The health department addressed this yesterday, and some feedback that came back from John Woodrich, who was in that meeting, is there's been 2 waves, essentially. The first wave of Johnson & Johnson recipients are beyond their window of concern. The second wave, we are encouraged to watch their symptoms. And then I also spoke to a few physicians around the building today, and they consider this actually a good pause, because when you're under emergency use criteria, this is exactly what you're supposed to do. And they asked me to remind everyone that this is currently affecting 0.00001% of those who have received the Johnson & Johnson. So when you compare that to some of the arguments against how deadly is COVID, it's not comparable. It's a very low number. We're considering it a good pause. Dr. Smith has a slide or 2 on that as well. So with that, I'm just going to bring up Dr. Daniel Smith, infectious disease physician, to talk a little bit about our variants, and then we'll open it up for questions. Thank you.
So I was asked to talk about variants in the vaccines, and also to touch a little bit on the Johnson & Johnson issue. So as most of you are aware, the CDC and FDA on Tuesday had announced a decision to recommend a temporary pause in the Johnson & Johnson vaccine. So what is the problem that led to the pause? And so you have to kind of be aware of the AstraZeneca issue. So both the Johnson & Johnson vaccine and the AstraZeneca vaccine, they both use an adenovirus vector to deliver DNA in their vaccines. And so there have been reports of similar blood clots going on since February in Europe associated with the AstraZeneca vaccine. And so we don't know yet if it's going to be the same mechanism as the AstraZeneca vaccine. And European researchers have found that the immune system kind of generates an antibody that activates platelets, which is similar to heparin-induced thrombocytopenia. And so it's an antibody to the platelet factor 4. And so in Europe, there have been about 169 cases of this rare clot. It's a cerebral venous thrombosis, and about 53 cases of splanchnic or abdominal vein thrombosis out of 34 million doses. So various countries in Europe, like France, Germany, they had kind of started recommending a minimum age of 60. And so with the Johnson & Johnson vaccine, over the weekend they had 6 cases, 6 women between the ages of 18 and 48. They had blood clots and thrombocytopenia within about 2 weeks of the vaccine. And so in those with the condition, so it's cerebral venous sinus thrombosis, and so clots form in the veins that drain blood from the brain. And so the advisory committee yesterday also learned about 2 more cases, and one was in a man who was part of the clinical trial. And so on the slide, you can see it was a 25-year-old guy. He had the cerebral venous sinus thrombosis, and he did have low platelet count, so thrombocytopenia, and also had this antibody to it. And there was also another case that was in the placebo group. So it was a 24-year-old woman who also had this clot, and but she did not get the vaccine. She was on placebo, and so she had recently been prescribed oral contraceptives, and so clearly not the same mechanism. And so in general, blood clots are very common, about 1 to 2,000 blood clots a day as a background rate. So they happen very commonly. But the cerebral venous sinus thrombosis background rate is less common. And so they think it's about 2 to 15 cases per million. But what's not very common is kind of the thrombocytopenia plus the cerebral venous sinus thrombosis. And so we don't really know the background rate for this combination. And so it does seem to be increased, but we just don't know. And so with this pause, the CDC and the FDA is trying to see if there are more similar cases. And so, but it's pretty rare in the U.S., about one in a million. And so what to do if you've gotten the Johnson & Johnson vaccine? So, basically, take a deep breath and relax. You got the vaccine, so you should be safe from COVID. And if you've gotten the vaccine more than 3 weeks ago, the risk is very low at this time. And if you've received it within the last 2 weeks, they're recommending to monitor signs for symptoms of severe headache, abdominal pain. That would be a sign of having severe abdominal pain, a blood clot in your abdominal veins, leg pain, so a blood clot in your legs, and shortness of breath, for a blood clot in the lungs. And so just monitor for those symptoms. There's not really much else to do. They don't recommend taking aspirin or anything at this point. And so they also recommend, so for physicians treating this syndrome, they're not recommending to use heparin because of the similarities to the heparin-induced thrombocytopenia. And so, it has the potential to make it worse. So they're currently recommending to using an alternative, blood thinner, basically. So other questions that they had wanted me to talk about was variants in the vaccine. And so, what do we mean by a variant? And it's basically when a virus replicates or makes copies of itself, and it sometimes changes a little bit, which is kind of, the natural history for a virus. And viruses constantly change through mutation. And so in the U.S. right now, there are currently about 5 variants of concern, and the UK variant is now the predominant strain in the U.S. And so in Nebraska, we have about 187 cases of the UK variant, but we likely have more, and it seems likely will become the predominant strain here in Nebraska. And so we also have about 48 cases of the California variant and 2 cases of the Brazilian variant. And so far, no South African variant cases. And so why do we worry about the variants? Multiple studies have shown that the UK variant is about 50% more contagious and also about 50% more virulent or pathogenic. So you have, concern to see, increased severe illness with it. And so, here in Nebraska, we are starting to see a rise in hospitalizations over the last couple of weeks. So another question that was proposed was, on vaccine efficacy against variants. And so, we do know more about how the Johnson & Johnson vaccine protected against the variants because the trials were conducted in South Africa and Brazil when the new variants had become prevalent. So they do show that the Pfizer vaccine and the Moderna vaccine is, efficacious against the UK variant. there was, 90 to 95% efficacy in Israel. So we do have real world data showing that those vaccines do have good efficacy on it. As far as the South African variant, it does. So they have had tests in looking at neutralizing antibodies in where they take the variant and they test the serum in patients who have had the vaccine, and they do seem to have a decrease in the antibodies to it, but there is still some efficacy against the South African variant. And so they also think that it has some, efficacy that works pretty well against the California variant, and also some efficacy against the New York variant as well. So as far as the, they do have second generation vaccines in clinical trials going on right now. Moderna and has clinical trials targeting the South African variant, and they also have a multivalent vaccine coming up that's in phase 1 clinical trials. So they do have kind of second generation vaccines that are currently being studied. And, also Pfizer and Moderna have started enrolling children 6 months and up. So hopefully, we can start vaccinating children 6 months and up, hopefully in the near future. And so another question that came up was on the surge in other states. And so you've probably seen the headlines in other parts of the country are seeing a rise with younger patients. And so Michigan, Minnesota, Florida, Colorado, and various states in the Northeast region are now in the red zone. And, Michigan by far has the highest rates of new infection in any state, and they have a really high rate of the UK variant there. So, I don't think anybody knows exactly, why Michigan and why now. But it's thought to be a combination of the variants plus, pandemic fatigue and returning to normal life without, not wearing masks and, not social distancing and those sort of mitigation, non-pharmaceutical interventions. So. And there's also been some outbreaks with indoor youth sports with, hockey, wrestling, and basketball in Minnesota and Michigan as well. So that may be contributing a little bit. They didn't really think a whole lot was coming from schools, but more from the youth sports. And so another question that came through was on prevalence of breakthrough infections after getting fully vaccinated. And so we know that the vaccines aren't 100%. In the clinical trials, it was about 95%, but, that didn't include nursing home patients and also immunocompromised patients. And so, probably not able to mount the antibody response that younger immunocompetent individuals can. And so it's kind of to be expected that you're going to have a small decrease of effectiveness in the real world compared to the clinical trials. And so, but even if you do get COVID after getting the vaccine, you should have less severe illness and also be less likely to transmit it to other people. And so, Nebraska right now has about 31% immunized from 16 and up. And so, we are a long way away from herd immunity. And so we need to continue masking and continue social distancing and all those other non-pharmaceutical interventions. So.